All right, everyone. Well, welcome to the Hemophilia Council of California and our first policy and advocacy webinar of 2021. This is the state of healthcare in California, what you need to know. My name is Lynn Kinst. I'm the Executive Director of the Hemophilia Council of California, and I want to welcome you today to our webinar. We also have with us Terry Cowger-Hill, who I'll be introducing in just a moment. Who will also be helping provide an update on what is happening in our state capital.
So apart from the impact of CalRx and CalAIM, the GHPP and CCS programs remain essentially the same and are fully funded in the governor's budget. But that didn't happen overnight. We have had longstanding advocacy and partnership with others in the rare disease community, and we continue to be a strong voice. So you'll notice every year when we have our annual legislative advocacy days, we have GHPP and CCS on those fact sheets because there's a constant change of staff in the Capitol. And legislators, while their term limits are longer and many are familiar with us and our programs, there's always a new generation of legislators that come through the halls of the state capitol and need to be educated on these programs because they're so vital to providing medical coverage for our community. It's absolutely critical that patients research and understand all their coverage options, including private insurance, Covered California, which is the state's ACA that contracts with a variety of health plans and provides subsidies for those health plans, Medi-Cal, GHPP, and CCS, or a combination of any of those programs can be just so vital for our community, and very few states around the country have GHPP or CCS type programs. We are also available to assist patients and local foundations in researching and understanding the available programs. And on a couple of slides that are following, we'll give you a lot more information on how to get in touch with those programs if you're having difficulty. So understanding your benefits, GHPP, and Lynn has provided a valuable link. And again, we will be sending these slides out, so you don't have to take notes. We will get this all out, and of course, the recording will be available as well. But this is a great resource. Adults with hemophilia are by statute guaranteed coverage under this program. In other words, hemophilia and rare bleeding disorders related to hemophilia are GHPP benefits in the state statutes. That includes care that you can receive at special care centers, such as the hemophilia treatment centers. You get hospital and outpatient medical coverage, pharmaceutical services, medications prescribed by your doctor, home infusion therapy, surgeries, and then some of these items like nutrition products and medical foods, those are for some of the other conditions, not so much for hemophilia. But durable medical equipment, that's another big one. That includes wheelchairs, crutches, any kind of device you might need for PT or OT. Other services include home health services, physical, occupational, and speech therapy, and mental health services, which Lynn will tap into a little bit later, and medical supplies that go with all of your factor. Those are all covered benefits under GHPP for adults 21 and over with hemophilia and related bleeding disorders. Note that each service has specific criteria for approval and must be medically necessary and appropriate to be approved. So CCS, hemophilia and related bleeding disorders are also benefits of the CCS program. While not provided in statute, the CCS program is broadly described in statute, but the details of what conditions are covered is in regulations at the Department of Healthcare Services, and hemophilia and related bleeding disorders are included. So again, it's very similar to what's covered under GHPP. The doctor visits, the hospital stays, surgery, physical therapy, occupational therapy, tests, x-rays, medical equipment, medical supplies, it's all covered. Medi-Cal case management to help you get the special doctors to refer you to other agencies such as public health nursing and regional centers is also part of that. And the medical therapy program is primarily in the schools. It's a little separate, and not too many in our community, I believe, use that. But those are a lot of the children that have other medical conditions such as cerebral palsy and others. We're in the special education programs. There's a whole side of CCS that covers that at the state level. And I should back up and say that GHPP is a 100% state funded program, while CCS is funded in part by the county governments and the state of California. So the eligibility to get onto CCS initially is usually done at the county office in your local area in coordination with your physician or specialists. And then you have to renew every year through the county, whereas GHPP, you renew every year at the state. And that's been a little confusion that we've had a lot of questions on in the last couple of years. So we just want to be really clear on that.
Thank you so much for joining us today. Again, the slides and the resources page will be up on the website later this afternoon, and we will get the video edited and up in the next couple of weeks. And we really appreciate you joining us today. Hope that you found this helpful, and just say thank you again to our sponsors, to BioMarin and HF Healthcare, for helping to make today's webinar possible.